There are other things that increase this work faster, but let me go back and describe that inflammation. What's the inflammation there? If you consider the lining of the artery of the heart of, let's say, a young child, you see there's only one layer of the cell inside of this artery. This is the cut of the artery, all right? And this is the muscular part. As we get older and the inflammation starts working on us, which is one of that most importantly is high cholesterol. All right? The high cholesterol, and I described to you the different part of this cholesterol profile. The fat tissue, the bad cholesterol, which is the low density cholesterol. We have different kind of cholesterol. One is the total amount. Then if you separate them, to remember the bad cholesterol is the one that should be low. That's why we call it LDL. The good cholesterol should be high. We call it HDL. All right? So the bad cholesterol starts penetrating into the wall of the artery. As it sticks to this wall, as a result of inflammation, call for the defense mechanism of the body come and help. And those defense mechanisms are white blood cells that always go after inflammation, get rid of it. If you cut your finger, you see it swell up. Why? Because these white cells are coming there to swallow the bacteria and get rid of them, and sometimes, like a pus, come out. All right, so the bad cholesterol gets into the wall of this artery and create inflammation that the wall of artery doesn't like it. Starts swelling up. What causes it to swell up? Those white blood cells, the soldiers of the body. One of them, we call it macrophage. It means big cell. When it gets into that to swallow the fat bubble, it creates a name called foam cell. Foam cell, F-O-A-M. And when it swallows that one, the macrophage, that cell, that soldier, call for other people to come and help me. I alone cannot get rid of all this cholesterol. So start calling more white blood cells come to the area, and then they secrete certain, again, product called matrix. I don't want to go to the detail of that. What it does that, it starts dissolving the thick layer of cap that is holding this together. All right? As long as this cap that is holding the swelling tight, like when your wound starts healing, nothing will happen. No heart attack, no chest pain, no shortness of breath. But assuming the person continue those bad things, smoking, weight, diabetes, high cholesterol, lack of exercise, all those kind of things, the swelling starts getting bigger and larger, all right? But this part, the cap that's sitting on it, is holding it tight. And that is defense mechanism for the artery not to cause the heart attack. But this can go on to a certain level. Beyond that, what will happen is the edge of this cap starts cracking. And that crack can happen in a fraction of a second. So I went to the doctor, checked me, gave me a stress test, said everything is okay. I came out, and within 2 hours, I ran after the train and dropped either dead or heart attack. What kind of a doctor are you? then we have to look at this, because there is no warning with this breakdown of the cap. As soon as the cap breaks, the stuff come out. All of them are like poison, because the body doesn't like it. That's why imprison that in this area, doesn't let it get out, because if it get out, create a, second war. And but assuming that it breaks, patient feels the shortness of breath, the chest pain, the feeling of getting a heart attack. Why? Because all of a sudden, remaining of the soldiers come to help, and one of that soldier called platelet. Platelet is a tiny cell, very small, that wherever you cut it, it goes there and stops the bleeding. It's its job. So as soon as it sees that there is some bleeding in the artery, it starts coming and call for more and more and more and create a clot. All right? That's what we call it infarction. Myocardial means muscle of the heart, and infarction means gangrene, actually lack of oxygen. So we have now the artery, which is totally closed. Now, this could be in the leg, diabetic, they get ulcer. This can get into the kidney, get kidney failure in diabetic, hypertensive people, usually many of them under dialysis. It could happen in the arteries of the neck, we call it carotid artery, cause a stroke, just like that. All right? So, now, this business can happen in two ways. One is very chronic, very slowly, and if it's slow, we may get a warning and go after it and take care of it. Patient come to me, listen doc, I used to carry my garbage bag to the corner, nothing happened. 2 days ago, I did it and I'm huffing and puffing. Something happened. What is it? Okay, multiple things naturally, but one of that could be that this is the start closing, but it's slowly, not by the crack and suddenly. So we have a chance to go give the patient a stress test, check this, check that, get them to the angiogram, see the blockage, open it with the balloon, and put the stent in. We save the life.